Everyone knows how expensive a hospital visit can be, but we usually don't find out how bad it is until after the visit. The sticker shock when that bill winds up being hundreds, if not thousands of dollars more than anticipated can be especially painful for those without health insurance. Now, a recently passed city council bill is hoping to address what many call a lack of transparency. The bill's sponsor, Councilwoman Julie Menin, is here to discuss it. Councilwoman, welcome to Picks on Politics.
Thanks so much, Henry. Great to be here.
So the mayor signed your bill late last week. Very exciting. Tell me more about it.
Well, it's really a historic moment because it makes New York City the first city in the country to have a healthcare accountability office. This is actually the only area where, as a consumer, you're procuring a service and yet you have absolutely no idea what you're going to be charged for that service. So, for example, a woman getting a C-section in New York is being charged $55,000 at Montefiore and $17,000 at another New York City hospital. So finally, we're going to have price transparency so consumers will know in advance what they're going to be charged at their most vulnerable time.
I mean, I can really speak to this sticker shock. We have two boys. Both times my wife gave birth, and both times it went down a little bit differently. It was like we get one bill from the hospital, it's a few $1,000s, and then one from a doctor, and then, okay, are we done? And then, no, the NICU, and then the anesthesiologist. I get maybe your bill wouldn't make it that granular, but we might have had maybe a ballpark of what to expect. Is that kind of what you're saying?
Absolutely. Yeah. You would know for the first time in advance what your family would be charged for these medical services, and you'd be able to see by hospital, by medical procedure, what these charges are. Now, certainly for uninsured, and 8% of New Yorkers are uninsured, this is a matter of life and death. It's really a game changer for them to have this kind of salient information. But even for those that are insured, you need this information in advance. And the other big benefit of the bill is that it brings down costs overall. Price transparency allows the city of New York, for example, to harness its purchasing power to drive down costs, and so the same for private employers as well.
So would it just be that New York, when it's paying for various medical services, would opt for lowest cost, or do you think the transparency will force the hospitals to lower their prices?
The transparency forces hospitals to lower prices. So, for example, New York City is spending $11 billion, or 10% of the city budget, on public sector employee, retiree, and dependent health care. Just by way of comparison, 5 years ago, that figure was $6 billion. So by knowing what these hospitals are charging, it allows the city to harness its purchasing power to drive the cost down. And that inures to the benefit of not only really every New Yorker. We could save potentially up to $2 billion, studies show, by doing that.
Now, let me get into some of the criticism of this, and I'm going to read here because I want to make sure I get it correctly. The Greater New York Hospital Association strongly opposed this bill. They argued that they already comply with federal regulations by publishing complete lists of prices. Why do you believe they oppose this bill? Why do you believe that their case is incorrect? Obviously, you disagree.
I completely disagree, and it's absurd that the Hospital Association is literally fighting a transparency bill, a bill that simply allows consumers to know what they're going to be charged. It's completely incorrect to say hospitals are complying. There is a federal rule that mandates it, but only 6% of New York City hospitals are actually complying with that federal rule. That is precisely why we need this legislation.
Well, if they're not really complying with the federal rule, and the feds have, I would argue, a lot more enforcement power than we do here in New York City, how will they comply with your bill?
A number of reasons. First of all, the City Council gives millions of dollars in discretionary grants to these hospitals in terms of equipment.
So the power of the purse here.
Right. Should we continue to be giving these discretionary grants if hospitals won't disclose their data? Secondly, we are giving $1.5 billion in city tax incentives to these private hospitals. Why are we continuing to do that if they won't comply with simple price transparency measures?
A couple of other matters at the end here. I know you're also working on a bill about panic buttons in Bodega. We're approaching an anniversary of something truly tragic that gripped the city. Tell me about your other legislation.
Sure. So Councilmember Althea Stevens actually is carrying that bill, and I have the companion bill, which would require plexiglass and security cameras in areas of high retail theft. So we've got a package that really deals with retail theft. The retail theft is out of control, and we as a city need to do something to tackle it.
And on the budget here, negotiations ongoing. The mayor wants cost savings in the form of reducing thousands of city jobs. Council's generally speaking opposed to that. I don't mean to speak for you in your specific positions, but wants more education funding, wants more library funding. Where are negotiations at? What can you tell us about that?
They're still ongoing. And look, education funding, library funding is absolutely critical. We don't want to see cuts. We also want to make sure that city agencies have proper staffing. I served as a 3-time city commissioner, so I know firsthand what it takes to run these agencies. There are a lot of vacancies, and we want to make sure that doesn't continue.
Councilmember Menin, I wish I could talk to you more, but we are simply out of time. Thank you for joining Picks on Politics.
Thanks.